In this video, we're going to talk about something important to many of us: cheese. But instead of focusing on all the good things cheese does, nachos, pizza nachos, we're going to talk about what's wrong with cheese. Swiss cheese in particular, because there are holes in Swiss cheese. Those holes could have been delicious Swiss cheese, and instead, they're just air. Now, to better understand how errors occur, we are going to use Swiss cheese as the steps, processes, and barriers that are in place in our organization when we carry out tasks, do projects, and take care of patients. We don't create these systems to intentionally have holes. We create our systems intending for them to be cheddar cheese, with lots of defenses to catch and trap errors in the process. The unfortunate reality for everyone but our mouse friends is that our systems have flaws that we don't even realize. Those are the holes. But the first most important takeaway is, safety and failure events rarely happen because one thing went wrong. They happen because of multiple things that go wrong and all line up. The perfect storm of Swiss cheese. And yeah, that image is kind of funny, but of course the problem is not. Sometimes these holes are failures of equipment or a faulty process, and when those things are reported, they can be fixed. Sometimes the holes are normalized deviance, which refers to the gradual process through which an unacceptable practice or standard becomes acceptable. As the shortcut behavior is repeated without catastrophic results, it becomes the social norm for the organization. This is unfortunate, and we need to recognize it and then change our practice. But we don't blame people for this. We acknowledge it as a mistake that groups of humans sometimes make. Sometimes holes are people-related, such as when a nurse didn't speak up because she was afraid the charge nurse would think her question was stupid. We need to fix these issues too. We can build on our teamwork and share stories and experiences to change attitudes and mindsets, and plug the hole in the Swiss cheese. When people's mistakes cause holes in the cheese, those mistakes can be categorized into 3 types of errors. This categorization helps us to see how the holes should be plugged because each type of error has particularly effective and different ways to prevent future errors. There are predictable ways humans make mistakes, and using that information helps us to prevent or catch those mistakes. So, without further ado, I present the mischief of errors. Did you know a group of mice is a mischief? Well, now you do.
Hi, I'm Skill-Based Errors. I'm the mistakes you make when you're on autopilot, like when you aren't thinking and put the milk back in the pantry instead of the refrigerator, or all the other slap-your-head moments you make silly mistakes without thinking. Humans are pretty good at not making mistakes when on autopilot, but you still do it. You're not perfect. You're human. I'm a mouse. You accidentally put the milk in the pantry sometimes, even though you know it goes in the fridge. You can't remember where you last placed your keys. Hint, also in the pantry. You forget to unclamp the IV tubing when you hang a medication because your mind is 10 steps ahead of your hands. You push reply all instead of reply and embarrass yourself via email. You knock things over or have butterfingers. You do all these types of things at home and at work. These are all skill-based errors. You can reduce the number of all types of skill-based errors by simply paying attention to the task at hand. Stop and think before taking action. In a future show, Fukashi will discuss a self-checking technique called STAR as a tool to prevent skill-based errors. The probability of experiencing a skill-based error is approximately 1 error for every 1,000 acts, or 0.1%. Clearly, humans are very reliable when in skill-based performance because you have a great deal of practice and expertise in performing the task. But the average person performs around 10,000 skill-based acts each day, meaning that you experience about 10 skill-based errors per day. So don't be surprised when you make them, because remember, you're all human. But you can train yourself to make fewer errors, because remember, you're all human. Humans who know the cost of a 1-second deep breath to make sure you're reliable is well worth it.
But there are 2 more kinds of errors.
I'm rule-based errors. Mistakes you make when you're thinking, if one thing is true, then a second thing must also be true. But you're either in a rush or applying the incorrect then to your if. For instance, this happens when a patient comes in with pain in their arm and the doctor diagnoses them with a sprained shoulder. But in reality, the pain in their arm was radiating from their chest and was the sign of a heart attack. Or when someone makes an assumption about what has happened, which causes them to act in ways that could cause harm. Again, we make these mistakes at work and at home. Sometimes because we aren't taking the time to think. Sometimes because we need to update the rules. Or sometimes because we know the rule, but we choose not to follow it. We think we know better. The various reasons are very human, but not very safe. We must all work together to recognize when we are in rule-based mode and might make a mistake, so that we can prevent harm. The probability of experiencing a rule-based error is 1 in 100 or 1%, making it still a pretty reliable mode for humans, yet most of the mistakes that cause harm in healthcare are rule-based errors. So that 1% adds up fast. The more we know, the better we can do. The best strategy to prevent rule-based error is to stop and reflect, or ask a friend. The worst thing we can do in healthcare is to not know the correct way to do something and then act on it before asking or finding out the correct way.
Hi, I'm the third and final way humans make mistakes. I'm knowledge-based errors. These are errors you make when you have a lack of knowledge. When you literally don't know something but act on it anyway, like when you don't know how to cook something and you don't use a recipe, you'll make mistakes and it probably won't turn out well. When you find yourself in a compromising situation, find an expert source. Someone or something that can provide the rules. If you see a coworker trying to operate from a place of knowledge deficiency, intervene to stop them and offer assistance, or help them find an expert source. Change your knowledge-based error into someone else's rule-based success. Physicians have an excellent strategy for preventing knowledge-based errors. They call for a consult. If the case is complex or beyond the physician's experience or expertise, they consult with a specialist who knows the rules. In knowledge-based performance situations, when you're unsure, 30 to 60% of your decisions will be wrong, a very high probability of human error. This mode of thinking has the highest error rate, and at RWJBH, we try not to be in this position as much as possible.
At RWJBarnabas Health, we work together to plug the holes through learning, improving, coaching, practicing, building teamwork, reducing power distance, changing processes, modifying policies, and by reporting the holes in our system the moment we recognize them, even if they don't cause harm. We report all events that need to be improved or learned from. We report exclusively in Verge, which everyone has access to and is on every computer in the organization. The form will walk you through the information to report, and we use these reports for learning and trending. We can report patient events, employee events, workplace violence events, and visitor, vendor, or non-patient events. Knowing when to report is easier than you think. When in doubt, report. However, the Department of Health and Human Services says that on average, only 1 out of every 7 medical errors is actually reported. Some people are afraid. Other people don't want to be a burden by creating work. Other people don't realize an event even should be reported. And because of this, it is often easier to assume that someone else will report it. Or, really scary, is that harm and failure events are so common, they aren't worth reporting. Here at RWJBH, we recognize you may feel this way, but it's our job to listen, respond, and improve so that you know it's always worthwhile to report your concerns. There may be times when our safety department will do a more in-depth review of serious or complex events after receiving the report in Verge. This is called root cause analysis. The purpose is to talk about the harm event that happened and what we can do to prevent it from happening again. It's not about blame or punishment, but about digging deep enough to understand the root causes that are living in our organization and sometimes setting us up for mistakes. Of course, the best time to report is before it results in a harm event. This is called a great catch. Like when a pharmacist catches that a physician entered a dosage of 150 milligrams rather than 15 milligrams and calls to double check. Or when a nurse noticed that a transportation company brought a wheelchair without a seatbelt. She spoke up to keep her patient safe. Or when EMTs interacted with someone who refused treatment for a fall but also seemed confused. They stayed with the patient and her spouse, working together to eventually get the patient to the hospital, where they identified she was, in fact, in a life-threatening situation. The best way we can encourage all of you to report safety events and great catches is by having a strong, fair and just culture at RWJBarnabas Health. A fair and just culture means that we distinguish between when an employee makes an unintentional mistake versus when they make an intentional or careless choice or take reckless action. Team members will receive fair treatment if they are involved in an adverse event, error, or mistake. We strive to be an organization worthy of your trust as we work together to improve safety and reliability. A fair and just culture helps us to manage the low-performing team members without placing blame on high performers who make a human error or were working in conditions that set them up for failure. This can sometimes be hard to trust because maybe you've been punished for making unintentional mistakes in the past or you've seen a coworker punished. We need you to know that we are different. We work hard to understand each person's experience, intention, motivation, and influences when they experience an error, mistake, or deviation from expectations. We even use something called the Performance Management Decision Guide to help leaders remain fair in their assessments after an event. However, when we have team members who are reckless, there are measured consequences and opportunities for improvement, such as coaching and training in the case of human error. When the decision guide identifies that an individual error was a result of a systemic failure, we work to fix this larger issue as well. Managers use this decision guide each and every time there is an error or mistake to determine the fair and just response. We know you will make mistakes, because we all will. But we are a learning organization, and we will learn together how to fix holes and prevent harm. Through conscientious and consistent reporting, we will help prevent each other's mistakes, so we have as few holes in the Swiss cheese as possible and reach zero harm together.